Watch your head.
Hey, you want to lean on this? All right, put your glasses up here. And we're going to work on that leg and have you walking better. Okay, good. Come on over here. There you go. Come on up. Hello, I'm Dr. Otto, chiropractor and functional medicine doctor. This patient is Adam, and he is suffering from a knee problem. We're going to go ahead and do a regular chiropractic adjustment to show you how chiropractic is in 2017. I know there's a lot of misinformation out there about chiropractic. A lot of people thinking about popping, cracking, twisting, thinking it's unsafe, whether heard on the movies or televisions or heard from medical doctor's office, and really a lot of those misconceptions are completely unfounded and really back mindset of 1930s, 1940s. So we're going to bring you up to speed with some of the more advanced techniques of chiropractic that a lot of different chiropractors use, including us in this office, and this is called the impulse adjusting gun. It uses up to 400 newtons of force to very quickly and gently tap the bone back in place. So, and any other regular normal adjustment would cause a lot of pain to someone that has an issue with the knee, but we're going to be able to gently tap that in place. And as you saw him walking up here, he's in a lot of discomfort with that right knee. So our main goal is to get some release of that pressure, make him feel a whole lot better, and be able to hopefully walk better when he gets up. All right, Adam, just keep looking forward, okay, bud? All right. And I'm going to very gently check the leg length. And since he has problems with that knee, I'm going to move this versatile table up, so it's a little bit easier on his knees. So first thing I need to do is level out the pelvis. I'm going to press here, which sends a message up to the brain over 270 miles per hour and back down at the same speed to affect the leg length and give us an indication whether there's a problem there that needs to be corrected. Just think of it as your crazy drunk uncle that gets pulled over by the police, and the police ask him to do what kind of test? Finger to nose test or Romberg's test. All of these are orthopedic orthoneuro tests from a neurologist to see if there's problems with proprioceptive. Well, we're using those same tests that the police would use on the spine of the person to find out what needs to be adjusted. So we're going to use this impulse gun to very quickly and gently tap the bone back in place. So it makes a very quick, light thrust, up to 36 thrusts in about 2 seconds. Very easy, very quick, very painless. Now that we have his pelvis stabilized, we're going to work on the knee. Now the knee is in bad shape, so there might be a little tenderness when we adjust this. Aside from that, the adjustments, as you see, does not hurt, does not cause any pain. This might be a little bit discomfort for him, but we got to get this knee doing better. So I'm going to bring my finger under the knee and challenge that proprioceptively. As I said, signal to the brain, signal back down the feet, shows that that right leg is short. So we know that there is a pattern that needs to be corrected with the patella. As the first one, we're going to get this adjusted. Just relax here. And this is going to be a little tender. Maybe not as tender as I thought. He didn't make a sound. So the patella was down, so we're going to adjust it up. The tibia or the leg bone was rotated out, so we're going to rotate that back in. and apparently he thought that was funny. And then we want to press down on the tibia itself very gently, which apparently was ticklish. That can happen. And we're going to very gently adjust the back of the knee like this. The last test of the knee is the outside ligament, which is called the lateral collateral ligament, and that is doing well. And then the inside, which is called the medial collateral ligament, and that's out of position. This is where we have the medial meniscus in this area. So I'm using the very lowest setting. It's 100 newtons of force. It's very, very light. It's a force that we use on seniors and babies. So very quickly and gently tap that ligament into place there. So I'm going to post check that, meaning I'm going to do a proprioceptive response. Check to see if that's in place, and it is. We're going to adjust the rest of the spine. Starting with the lower lumbar spine, I'm going to use motion and static palpation with the skills and knowledge I've acquired over 20 years of practice. Almost 20 years of practice. 19 and a half. I'm going to very quickly and gently tap that bone back in place.
Sound like it's gonna meet, baby.
Yeah. And there was a little tender spot on there, and it can also be a little ticklish too. We're going to take an adjustment on the right side of the atlas. Atlas is the most important vertebra in the spine. It is the vertebra with which the brainstem comes through. And the thing to note about Down syndrome patients is that that's a very, very gentle, delicate area that you don't want to be doing a manual rotary brake, which is great because we don't do any of that in the office anyway. So I'm going to get right on this right atlas with the very lightest force, the force for seniors and for babies, and very quickly and gently tap that bone back in place. And we're going to use some more gentle force to adjust some of these other fixations in the neck. And then also in the thoracic spine, and again, I'm just reading the spine like a blind person reads Braille, going down and feeling for where the bones are stuck. Sometimes it's a little ticklish, as we've noted earlier. All right. And that is it. That's the chiropractic adjustment. And as Adam gets off, we'll ask him to take a few steps. Now he's still going to be favoring the left leg because he still has issues with that, but it should be a little bit better. So let's go and do some walk, okay? So come on this way. Let's walk down this hallway. Let's see how different he might be. Limp in, leap out. That's what chiropractic does. Limp in and leap out. Come on, take a walk here. And notice he's not holding on to anything anymore. We're off camera here. Hold on, let's come back over here. Come over here. Come over here. And this is a thank you we get from taking care and helping his knee. Come on back this way.
Right?
Yeah. Yeah, come on up. Yeah, come on up. Let them see you walking again. Yeah, come on up. So he's still favoring the left leg, but as you notice, that right knee is much better post that adjustment.
Right?
Now that they can see us. Do you want to give me another hug on camera? All right, thank you guys. You can check us out at discoverhealth.us. You'll see in the bottom left-hand corner, or you can give us a call, 272-AUTO, 272-OTTO.
That's Joe.
Take us out. Say goodbye.
Yeah, that's you, yeah.
Happy New Year.